Great. Thank you. Good morning, members of the media. We're really glad that you joined us again. I'm Cassie Sauer. I'm the CEO of the Washington State Hospital Association. And again, this week, we've got a great panel of folks to speak with you. We've got from Skagit Regional Health, which is located in Mount Vernon, Dr. Connie Davis, who's the Chief Medical Officer, and Brian Ivey, who's the Chief Executive Officer. We have Rosalinda Kibbe, who is the administrator, which is the equivalent to a CEO of the Columbia Basin Hospital in Ephrata. I'm here. You all have often had questions about the rural perspective. We're delighted to have Rosalinda to help share that. Tom DeBoard is the Chief Operating Officer at Overlake Medical Center in Bellevue, and Overlake is one of the partners on the Microsoft, Starbucks, Overlake, Evergreen mass vaccination site being planned for the Microsoft campus. So we thought it'd be great for you to hear how that planning is going and what's the capacity looking like. And finally, Rhonda Wellner, who's the Director of Quality from Astria Health, which is located in Sunnyside and Toppenish, and has, we think, a particular responsibility, as does Skagit, Columbia, and Astria are all really thinking about equity and particularly how they target farm worker communities where the virus has been hit so hard. So we're delighted to have this group of people. We'll start with some opening comments. I'll make some first, and then we'll hear from others. The hospital capacity remains okay in our state. We are not at the place, we keep saying this, hopefully we keep saying this. We're not in a place like we see in California or Texas where hospitals are becoming overwhelmed or already are overwhelmed. And we continue our really strong collaboration among all of our hospital members to make sure that every patient can get care in the state. And we're very grateful to Washingtonians for continuing to wear their masks, keep distant, and keep their gatherings small. I think of really interesting note in the last week, to me anyway, is guidance that's coming from public health officials that we should be wearing better masks. And I think really calling on your readers, viewers, and listeners to think about the quality of the mask they're wearing, that especially a bandana or a gaiter, a thin kind of a mask is not effective enough, that they really should be at least 2-ply, preferably 3-ply, and that if possible, have something that's resistant to moisture, so the moisture isn't moving through it. So that's, I think, a worthwhile thing for everyone to consider is do they have a mask that's up to the task of keeping them safe? And at the beginning of the pandemic, the mask talk was your mask protects me, my mask protects you, and I think there's more and more evidence that my mask protects me. It also protects you, but definitely protects me as well. So we really urge people to do that. We are concerned about the new variant being found in Washington State. We are concerned, obviously, about the word that it's more transmissible, even more concerned about the possibility. I think we're still having a look at the data that it's more deadly. Both those things are really concerning. And so urge Washingtonians to very much double down on what they're doing right now, to continue to be very careful about wearing their masks. We're really good mask wearers in the state. We need to be as good or better as we are now, to be keeping their gatherings small and to be staying at home, not traveling as much as they possibly can. We're excited about vaccinations. They're continuing to go well. The fact that we got to go to B1, we've told you all a couple of weeks ago that we were ready for B1, so we're really glad that we're there. That allows us to fill those appointments without any problem. There's a lot of B1s who want to get vaccinated. So those folks who are over 65 or people over 50 living in multi-generational households. And we're continuing to vaccinate the 1As, healthcare workers, long-term care workers, and staff. So with that, I think I'll turn it over to our panelists to provide some opening comments and just describe what they're working on, and then we'll take your questions. So Tom, I'd like to start with you if you're willing, because I know there's a lot of excitement and interest in the mass vaccination site out of the Microsoft campus. So if you could let us know how that's going and what you're working on and what your capacity looks like.
Great. Yeah, good morning, and thank you, Cassie, and good morning, everybody. I'm really excited to be here on behalf of Overlake Medical Center and all of our staff that are just doing outstanding work. 11 months now into this pandemic, and still continuing to work very hard every single day to take care of our community. So we're excited to be here today. As Cassie mentioned earlier, we're still continuing to be very busy. As a hospital, it's winter now. Most hospitals get busier in the winter just for normal kind of winter respiratory and other things. So we've been staying busy, but not overwhelmed. Certainly, I think our census this morning, we were at about a 75% occupancy. And here at Overlake, we only have 8 COVID patients. So we've been staying very stable, and our team has done a great job managing day-to-day operations and healthcare of the COVID patients that are coming in. And obviously, we've been spending a lot of efforts over the last month really on standing up our vaccine clinic here at Overlake and making sure that we can meet the expectations from the governor and the state relative to, and also King County Public Health. We've been working in collaboration with King County Public Health as well to make sure that we're all meeting the needs of our communities. So we were asked to stand up a vaccine clinic and be able to ramp up to be able to do 500 vaccines a day. And we've done that. We've been hitting over 500. We've been as high as 700 per day. And then last Monday, the governor came out with his new plan of Drive to 45, which is to get to 45,000 vaccines a day across the state, and really asked all of us to ramp up our capacity. So we've worked very hard over the last week to be able to do that and increase our available slots. Here at Overlake, we ended up shutting down an urgent care clinic, and we're able to, based on our capacity within our other urgent cares, feel comfortable that we're still able to take care of all the patients that need care, but be able to move that staff over to help us with our vaccination clinic. So we've done that. So we're actually growing from, again, being able to do 500 to 700 vaccines a day to this week, we're going to be doing in a range of 800 vaccines. And then over the next week, getting up to about 900 vaccines. And by the week of February 15th, to be able to have a capacity to do up to 1,000 vaccines a day. So we've been working very hard on that, and looks like our plans are working. We're getting people scheduled. And as we've said all along, and you've heard from many of us, the real big issue is to continue to get the vaccines in. We were, asked to set up this additional capacity. And then obviously we all then are very hopeful and optimistic that we'll continue to get those vaccines, but that will be critical to making this successful. So here at Overlake, we've received to date a total of 12,675 doses of Pfizer. And as of the end of today, by the end of today with our clinic, with what we have scheduled today, we'll have administered over 10,000 of those doses. So we're really excited about it, over 80%. And we're continuing to add appointments. And this week alone, we have 3,800 appointments scheduled this week. We have doses that we've received that we'll be able to administer those doses this week. We have not yet heard what our allocation, what we're going to actually receive this week. So we don't know that yet, but we're at least able to meet the expectations this week. But of course, obviously, are always concerned about what we're going to get next week and the week after, because that's critical, being able to do the vaccines. And then just briefly, we've been very excited. Overlake Medical Center and Evergreen Health in Kirkland have a joint venture called the Eastside Health Alliance. And that alliance between Overlake Medical Center and Evergreen was contacted by Microsoft and then ultimately Starbucks to look at, could we do something on Microsoft's campus in Redmond to create a high volume vaccine clinic, in essence, a mass vaccination clinic, where basically Overlake and Evergreen would in essence pick our clinics up, move them to the Redmond campus, not duplicate it. We just don't have the ability to have clinics here and there, but pick them up, move them to the Microsoft campus, start with the allocations of what we have now, which again, we're ramping up to in the next couple of weeks to be about 1,000 doses a day. I think Evergreen's probably around the same. And then, but with the ability to be able to ramp up to say 5,000 doses a day, if the vaccine allocations are available and we can get the doses. So we've been planning that for the last few weeks. We're optimistic that we can do this and do it in a safe environment. Both of our hospitals, like most hospitals, have set up vaccine clinics in our hospital, which isn't necessarily ideal with all the other healthcare going on, but we've certainly made it work. But being able to have a much larger facility with lots of parking, logistics support, security, et cetera, really we think can be a great thing for our community. So we're excited about the collaboration between Overlake, Evergreen, Microsoft, and Starbucks. We're going to try to do a soft launch with some just testing next week and then see where we go from there over the next couple of weeks.
Thank you, Tom. And I think one of the things that we are struggling with in Washington State that some of our colleagues in Arizona and Texas don't have to is we need places for people to wait their 15 or 30 minutes afterwards that are indoors and sheltered. And you see people in Arizona and Florida just sitting out on big lawns after they've gotten their vaccines. We hope that we'll get a good spring and be able to do that. But we're excited for the folks, Lumen Field, Microsoft, other Seattle University people that are offering big spaces that they've got that are currently unused for vaccine. I think that's a really good solution. So Rosalinda, why don't we go to you? Because I think you've especially had concern about people coming to the hospital. To follow up on Tom's comment about how the hospital building might not be the ideal place, and I think you've got some comments about don't show up at the hospital just looking for a vaccine.
Hi, yes. So here in rural central Washington, we have we only get vaccine 100 doses a week, which we give out every week. And a few weeks ago, our local health department challenged us with finding the capacity to give up to 100 or 125 doses a day, which is quite a bit for us. We normally see about 70 patients a day through a rural health clinic. So we're really being asked to double our throughput in our clinic, which we did. However, our allotment of vaccine doesn't match that. So we're waiting for more and more vaccine. But in the meantime, we give it out as quickly as possible. But with the governor's announcement last Tuesday, of 65 and older and the 50 plus multi-generational households, the onslaught of phone calls was amazing. The response in our area of people wanting the vaccine is tremendous. And it did overwhelm our systems. And we did have people, and we still did as of Friday, coming to the facility saying, I want my vaccine. I want to be on, we have a wait list of 1,000 people right now. And I want to be on that wait list. I want my vaccine. And so that's challenging. We have very restricted access to our buildings right now. We also have nursing home residents, assisted living residents. We have high risk people here that we care for. And so we've had to work a lot in our community to try to quell the demand per se and funnel things to a hotline that we've set up specifically for the COVID vaccine wait list that we're managing right now. But we're happy to do what we can to help our communities, and we definitely have served several of the small communities who have signed up for the vaccine program are barely getting their first doses this week. So over the last 5 weeks, we've been supporting as well as with a large partner here down the road, Samaritan Healthcare. They received the Pfizer, we received the Moderna. They have stood up clinics in some of the smaller communities that have not received vaccine yet. And then we have people traveling from those communities to our clinic to also get vaccine. And so we're so excited that there's such a demand for the vaccine, but we just need more, and hoping that we can continue to support our community as much as possible.
Thanks, Rosalinda. Rhonda, I think we'd love to hear from you especially about your work in thinking about for Astrea, which is, serves quite a high immigrant population and many farm workers. How do you get people to come both for treatment for COVID and for vaccines when they might be worried about getting that care?
So, can everybody hear me?
Okay. Yes.
Thank you, Cassie, for having me on. Like she said, my name is Rhonda Wellner. I'm the quality director here for Astrea Health. And it has been a challenge in our community to encourage the people that need help and need ongoing health care, that the hospitals and the clinics are safe. And we are here to provide unnecessary ongoing management for all disease process and illness and injury, not just COVID. So we started with the Moderna vaccine. We received it on the 23rd and 24th of December and started vaccinating our 1A frontline staff on Christmas Eve. Our Toppenish and Sunnyside hospitals have scheduled clinics 3 to 5 days a week as we receive additional shipments. And on Friday, we had our largest clinic. It was an offsite coordination with the Toppenish School District, where we were able to vaccinate over 320 1B from our community. To date, Toppenish has received 1,900 vaccines. Sunnyside has received 2,100. After vaccinating all of our 1A frontline staff, as those that wanted it, we opened up the supply to 1A in the community. And that included local law enforcement, sheriff, state patrol, the U.S. Marshal Service, fire, EMS, our local nursing home providers, as well as school nurses across the valley. On the January 18th, we opened up to 1B, and that community interest, just as everyone else has reported, has just been tremendous. It's just exploded, actually. The lower Yakima Valley is very eager to receive this vaccines. So to give some perspective, our communities are really built with large families living in multi-generational households. Our area really has a high number of social determinants that are affecting our population, including poverty, language barrier. We have a very high Spanish-speaking population, transportation concerns, as well as access to healthcare. These community members are a large part of our essential workers. They're employed in agriculture, food processing, and food delivery. And this population has really experienced COVID infections at a greater rate and have increased morbidity and mortality. So this vaccine is really bringing hope to our community for the ability for community members to be able to provide for their families safely and kind of get on with life. So vaccine distribution really has been a combination of perseverance and chance. There have been so many calls and emails for individuals looking for the vaccine as soon as the A1 phase opened up. We are finding, that those with access and knowledge to the use of technology really are more likely to gain access to the vaccine. So this is an area of opportunity to really make sure that we're reaching out to all populations and ensuring that there's not a disparity there. So Toppenish right now has 420 on their wait list for scheduling. For Sunnyside has on their wait list. Toppenish has received hundreds of voicemails and emails each day. Communication with the public and 1A has mostly been word of mouth. We've utilized social media. We're publicized on Phase Finder, as well as the health department's website. We return calls and emails and schedule appointments as we get them. This is a very laborious process. We've been collaborating with our local health department, various clinics and other health entities in our community, as well as first responder organizations, school districts, and city governments. We're really all trying to work together to provide logistics to provide vaccine on a larger scale and get more of this vaccine out into the community. Stray Health is really hoping that we can continue with vaccines this week. As of right now, we will be administering all of our first doses. Sunnyside has scheduled 219 doses this week. And Toppenish, will use all of their on-hand doses. We have 390 currently, and those are covered the second doses for 1As. Additional challenges that we're facing are limited to human resources, navigating logistics of the vaccine throughout the community. We are a small rural hospital. Both hospitals are small. Not to mention the increasing and demanding documentation and reporting requirements that go along with this vaccine. And we're finding it's taking longer to actually document and report the vaccine than it is to administer. So we are hoping that we can continue getting a reliable stream of vaccine so we can continue offering additional off-site mass vaccine clinics and also to complete the series of in-house vaccines that we've already scheduled for not only our employee, but all of the 1A in our community that have come to our hospital for the vaccine. The county is working on getting more resources for some of these off-site areas, as the hospitals are small, to try to navigate 100 to 150 people a day. The hospitals really have carried the burden until recently when the clinics were able to get more of the allocation. We have stepped up and really tried to provide that service and this vaccine to our community. We want to continue with that work. From a perspective of the COVID vaccine in Yakima County, thankfully, hospitalizations are on the decline. In our Toppenish and Sunnyside hospitals, we have seen entire families affected by a severe disease. We're small, so our availability and access to resources can be really strained at times. And we've had significant challenges trying to keep our patients local. We are continuing to care for COVID patients and any patients in our community that have healthcare needs in our hospital and our ERs. So between phone calls and emails, there are thousands of individuals looking to get vaccinated and are reaching out to us. As the phases roll out, we imagine this number is just going to be exponential. And with each clinic that we're having, our numbers of patients that we're able to vaccine has increased. We're improving in our speed. We're adapting to processes to make the biggest impact. And I really want to share that the best part is the relief and gratitude of our vulnerable community members when they're receiving that vaccine. And also, it's really raising the spirits of staff. We have our frontline staff, our nursing leadership, our MAs, and our clinic staff who are running these vaccine clinics. And it's really giving us hope and giving us a new perspective. And we're just hopeful that Yakima County continues to receive vaccines so we can continue, these processes that we've put into place.
Thank you so much, Rhonda. Really appreciate that. I think that the comments about the reporting system are worth noting. I had a chance to visit the Seattle U Swedish Seattle U clinic this weekend, which was featured in the Seattle Times over the weekend. It is fantastic. It is a fantastic location. It's really exciting. They have 2 data entry people for each vaccinator. That's the ratio they've decided they need. So they're actually using a lot more people to just do data entry than they're doing vaccinations, and it's cumbersome. So that has been a reason why the data has shown, we've said several times, the data is not correct. It's showing a much lower amount of doses administered, and it's really the record keeping is so challenging. We actually, I will tell you, I think we have some news that might be of interest to you all, that we are collecting data from our hospitals. We haven't done this before, but we decided to do so because the data, we're struggling so much with the reporting system from the state. So we're asking our hospitals to share with us weekly, probably just for 2 or 3 weeks, hoping that the state system is going to catch up, about how many doses they've received, how many they've administered. And we've also recommended to hospitals that they consider putting on their websites a vaccine tracker. And I'll just show you one right now. Let's see. Can folks see that? Is that showing everybody? Tom? Okay, so this is at the UW page. This is their COVID vaccine tracker. This is how many vaccines they've administered and how many people have received their first dose and how many received their second dose. So I think you'll see more of this on hospital zone pages so people can see what's been provided. I have to unshare that. I think I will also note that we're working with the state, I think, in a really good way to think about other kinds of professionals who can vaccinate, and the state has the ability to provide some scope of practice relief. And some of these are kind of fun to think about. For example, veterinarians and veterinary technicians, they give a lot of injections to creatures that are a lot more squirmy than humans, and they know how to do it. And so to put a shot in a calm human's arm is very different than a squirming puppy. And so I think, they've been interested in volunteering or being involved. I think they'd be great. Acupuncturists, another good possibility. Obviously, lots of proficiency with needles. Physical therapists. There's a number of eye doctors who do injections into eyes, also a lot more challenging than injections into arms. So these are professionals who handle needles all the time, handle injections, but don't have in their scope of practice the ability to administer vaccines. And we're working with the state to try to get them added to the list so we can just expand the pool. And there's a lot of interest in these groups and volunteering. So we're excited about this prospect as well. All right, Brian and Connie, let's hear from you.
Thank you, Cassie. Well, at Skagit Regional Health, at the risk of repeating some things that have already been said, we're actually very excited about where we are in terms of the vaccination process. This is obviously something our communities need drastically. I am very pleased that we've been able to set up a couple of off-site clinics to provide vaccinations, both up in Mount Vernon, which is in Skagit County, and down in Smoky Point in the northern tip of Snohomish County. It was a great idea to move them off-site because the demand, as you can bet, has been significant. We've given out so far a total of a little over 5,000 doses, including about 57% of our employees have gotten at least their first dose and working on the second one. We've built the capacity through these clinics to do about 600 patients a day, and we are increasing that. We have found the big issue with us, obviously, is staffing to be sure that we can maintain these, but also an appropriate area for the patients to be monitored and observed. I'd like to say Dr. Davis, who was good enough to work in one of our clinics this weekend, reports that we've gotten it down to a 3.5-minute process of paperwork and giving a patient the vaccination, and then the only delay at that point is the 15-minute of observation. So certainly has taken the clinics to a very high level in terms of how we can get patients through. The big issue, as everybody has mentioned, is the availability of vaccination coming into our state, or excuse me, vaccine coming into our state. We ended up last week with going to 1B, reaching a pretty critical point by the end of the week. We have stopped scheduling additional appointments right now. We are sitting with about 5,000 or so opportunities for vaccination out there for people who still need to get them, and just a little bit less than that in terms of our available vaccines. So we are very concerned, obviously, about the continued receiving that vaccine on a regular basis. As Rosalinda said, our phone systems can't handle the demand. Our community is so excited about this. It has certainly put us in a very big challenge in terms of phone systems going down. We've established a process to do it online for our patients, but that's limited. And so we ended up stopping making new appointments on Friday. And over the weekend, Friday afternoon, excuse me, we started a wait list. That wait list has grown to 9,000 people this morning. And we are getting people from anywhere from King County to the Canadian border who are looking to make appointments. We certainly believe people are making multiple appointments where they can get one in, and then the difficulty is if those aren't canceled, it puts the planning for the future at a problem, and our ability to provide a vaccine consistently. So we are very, very supportive of the 45,000 doses a day for the state. We think it's something we need to work towards as Washingtonians, but we do remain very concerned about the flow into the state and our ability to maintain these high levels of capacity that we frankly are so proud of building. But we certainly want to participate, and we feel good about the long-term future. It's just going to be a little bit of a rough road as we get there. Again, Cassie, at the risk of repeating, I think I'll end with that.
Thank you so much. All right, so now I think we're open for questions. Actually, I do want to make one more comment about the mass vaccination sites. It's a concern that we will see. I think we're going to be interested to see how this plays out, but we've heard from a number of hospitals that operate in more remote areas where the vaccine is going to a central mass vaccination clinic, that they're, especially the group that's being vaccinated now, has some mobility issues. So then the notion that they would need to travel for, 45, 50 miles in rural communities to get to a vaccination site, that may be really out of range for them. And also have heard some concerns, and I'd be happy for Rhonda, especially you and Rosalinda, to comment on this, some concerns about immigrants potentially being unwilling to go to a vaccination site that's military staffed. It looks like it's government run. Hospitals have a very, very, very long and proud tradition of serving everyone who walks through our door. We have resisted and fought against efforts to require, for example, hospitals to collect immigration information before we provide emergency services. We use something we're totally not willing to do. And so there's a lot of trust in the community for hospitals. And so we want to be sure that all the avenues for vaccination continue, that we do the mass vaccination clinics, which I think will be really great for high throughput and efficiency, but we also make sure that we've got really assuring equity and access to all, that we've got vaccine dispersed throughout the state into trusted sites as well. Okay, so happy to have questions. There's one that's come in that's with limited supply across the board. Is there any concern on part of healthcare providers that these mass vaccination clinics will further strain your ability to work through waitlists and vaccinate your patients who qualify? Seems as if there's a lot of confusion with people signing up for waitlists directly with their doctor through county health departments and now the state. I think I think Brian really articulated this well. We're concerned that we've got people making multiple appointments. They've heard that some appointments have been canceled, and that is going to be challenging for us. We are very supportive of the mass vaccination clinics. We want them to go. We want them to succeed. Our hospitals have actually been providing a ton of technical assistance to get them set up. Almost everybody's been to everyone who's working on mass vaccination has been to visit the Swedish clinic, which is the biggest mass vaccination site we've got now, and learning from it. Swedish has being very generous and sharing all their job aids, all their processes, and really we want to do everything we can to help them succeed. But I think we want to be sure that it's, again, a multi-pronged strategy, that the mass vaccination clinics work, hospitals continue to work, et cetera. And that we all, we're all really working together. It's going to take everyone, the pharmacists, hospitals, the state, counties, public health departments, National Guard, all working together to be able to get this done. And we want to go fast. We want to be in a place where you've got a lot of people vaccinated as soon as we possibly can. Okay, Allison, you would like to ask a question, so why don't you go ahead?
Thank you so much. And it goes along the lines of what we're already talking about. But, looking at Swedish as the first mass vaccination site in King County, they're going to have to pause on Wednesday because they're not getting an allocation this week. What does that mean to places like Microsoft, Overlake, Evergreen, as you're working on moving to that campus? What does this bode for the first King County vaccination site not getting an allocation this week? Is it because of the 4 sites in other parts of the state opening, or what are your thoughts?
Yeah, this is Tom DeBoard again from Overlake. And, as I had indicated earlier, what our game plan is to basically eventually pick our clinics up from both Overlake and Evergreen and move to Redmond. And starting with the current allocations of doses we're getting now. So we've been vaccinating between 500 and 700 a day. We're moving towards a plan to get between 700 and 1,000 a day. And we've asked for doses to do that. We have enough. We have over 3,700 appointments this week, and we have enough doses to be able to do that. And of course, have asked for new doses to come this week, which will help us move into next week. So it is very dose dependent. We have enough to manage the doses we have now. So the hope is by moving to the Redmond Microsoft campus, where there's much more space, that we'll start with the current volume of vaccines that both of us are doing today, but with the ability to grow up to, say, 5,000 doses a day and really make a significant increase to the amount of vaccinations we can do. But again, it's all going to be dependent on having enough staff there, which we think we have plans to be able to do it, and then getting the doses. So that is going to be critical for us to be able to do it. So it's not taking doses, for us at least, for the collaboration that we're doing with Evergreen, Microsoft, and Starbucks. It's not taking doses away from us, because we're just picking the doses that are already allocated up to us and moving them to Redmond. But in the end, we need to continue to get those allocations and then eventually get more, because we can never grow the capacity without getting more doses. So we've been in contact with Department of Health. We've been in contact with King County Public Health and are certainly collaborating with them, because that is going to be the key component. We're really excited about the partnership. Microsoft brings space, event planning, all kinds of logistical support that they can do. Starbucks has lots of expertise on efficiency and scheduling and all those kind of things. So I think bringing all of those pieces together can really help us create something special. But in the end, it's going to require us to continue to get the doses we're currently getting, and then obviously get more over time.
And Allison, to your question also, I think our preference would be that the state, as the vaccine supply increases, that we think about giving vaccine at the same level to the providers who are demonstrating that they can get it out, the folks who've been doing it already. And then as the increase happens, that we build more providers in. I do think it's a shame that the Swedish clinic is, they have ability to do 10,000 more vaccines this week than they're going to be able to. And it's as I mentioned, it's a fantastic clinic. And so it's too bad for it to be canceled. And I think it's really stressing people out locally who were on the waiting list for that clinic and hoping that they could get in. Rosalinda, go ahead.
Yeah, it's important to note that the rural communities are also receiving a reduction in their allocation. So it's not just these mass vaccination clinics or facilities the large urban facilities that are getting reduced. We are as well. And so it's kind of, from our perspective, kind of helpful to see that equity of reduced allocation is happening regardless if you're rural or urban. And so, but absolutely, we all need more vaccine.
There's a question about, are there plans in place at the state level to ensure that short-term visa workers and immigrants will be able to get vaccinated, or is this going to happen predominantly at the local level? As I mentioned, and we're really grateful to the governor and Department of Health for this, they have not had any policies in place that would prevent immigrants from being vaccinated. You've seen some states do that, so you have to be a lawful resident, a lawful permanent resident in order to be vaccinated. We don't agree with that, and we're really glad that our state's not taking that action. Our vaccination clinics are wide open, and we are in fact doing a lot of work to try to encourage people to come in. As I mentioned, the hospitals tend to be very trusted in those communities. There's, people give birth, get sick, get injured. They all get care at the hospital. There's translation services. There's help for them. There's no immigration action ever. And so I think that hospitals can be a really good spot, or also the community clinics like the farm workers clinics, for example. Those can also be terrific sites for people to get care. Rhonda, Rosalinda, anything you want to talk specifically about how you're reaching out to those communities?
Hi,
Absolutely. Go ahead, Rhonda.
Okay, so a lot of our patients are through our Estrella clinics, and we've been reaching out to 1Bs to get those vaccinated, as we did on Friday. Farm Workers Clinic has also, I believe, got an allocation that they're working through. I don't know the totals of that. But as a county, we definitely want to ensure that that vaccine is available. That's why we still want to keep advocating that Yakima keeps receiving doses.
And I'll just add that we do not check that information at the door. We're open, they know that. And like Cassie said, we are trusted in our community. They know they can come and get care without any questions.
Absolutely. Our hospitals are definitely trusted with the migrant community and the immigrant communities.
Thank you. All right, here's the concern about what is the concern about the UK variant showing up in Snohomish and Pierce counties and the impact it might have on hospitalizations. The concern is high. We're very concerned about this. And that's part of my opening comments about be sure you're wearing your masks, wear a better mask than you're wearing now. If you're wearing a bandana, stop wearing your bandana, get a real mask. If you're wearing a single ply cloth mask, get yourself a 2 or 3 ply one, or get yourself a surgical mask and wear it everywhere. I think both what looks for sure that it's more contagious and then what might be true that it's more deadly, I think is really a big concern. I think I'll ask Dr. Davis if she'd like to comment on this.
Well, I'd just like to say thank you for the masking comment, because we need to make sure that we are masking, distancing, and washing our hands. As far as the real issue, if it is more infectious, then there's a higher probability that you are going to get infected, and then a higher probability just by sheer numbers that we're going to have more people that are sick. We're all waiting with bated breath on the increased morbidity and mortality from the virus, but your concerns are, I think, well-founded. So far, we're doing all right. We do still have an uptick in our area of our hospitalizations, but we're able to so far manage things well.
Thank you. We have a question I don't know the answer to, and I don't know if anyone else does. We're hearing the state's mass vaccination sites will be limiting vaccine to residents in the county where they are established. Has anyone heard that?
I've not heard that.
It doesn't mean we don't. We just we may not know. So I think that's a good question for the Department of Health. Okay. That question about our data collection. Can I expand on WISH's data collection? What data is being collected? Where is it being collected from? And what data will be available to journalists? So we are asking our member hospitals, this is just voluntary, if they would like to do so, to let us know how much vaccine they've been allocated, both dose 1 and dose 2. We're trying to also one of the problems with the state's data is it doesn't reflect transfers. And as we've described to you in prior weeks, we were really active in transfers to make sure that we were having enough vaccine all around the state. People were doing, sending dry ice trucks and late at night to go pick up vaccine and quickly getting it administered, and lots of really good cooperation about transferring vaccine. We worked with Swedish, for example, to transfer some vaccine to Skagit when Skagit was out and they had appointments scheduled, and Swedish quickly released 500 doses to Skagit. So we're going to be correcting for the transfer so that it shows what you actually got and kept, or that you received from the state or by transfer. And then how many first doses you've administered, how many second doses you've administered, how many appointments you've got scheduled, and how many appointments you could schedule if you had enough vaccine, like how many people you could serve. And we're going to put that on our website. We just asked people to send it in to us over the weekend. So we've got some data. We're going to be collecting it throughout the day and tomorrow, and it'll be up on our website by hospital name. As I said, we're hoping we only do this for a couple of weeks. We're hoping the state's, the state's starting to collect this data too, that they'll make it available so we don't have to. Right now, our hospitals are now reporting their vaccination data to the state. the federal government and to us, which doesn't make us particularly popular to have a third data request. But we felt it was important to tell the story because we don't think the story is being told accurately right now. So it will all be available to you. And an interesting thing about it, actually, I looked at some of it that we've gotten in that I was scratching my head over, that some hospitals are reporting more doses given than received. And then I realized it's the 6th dose of Pfizer that really changes that, because you're allocated 5 doses per vial. And then if you can get 6 and sometimes 7 doses out, and occasionally you can get 11 doses out of Moderna, you'll have a larger numbers of vaccine administered than you received. Another question is WSHA continuing involvement in the vaccine redistribution efforts, and how is that going? We aren't really very much right now, because since we were involved in redistribution when we were at the end of 1A, and there were some hospitals that had completed 1A and still had vaccine, and some hospitals that still had 1As left and didn't have any vaccine left. And so we were working on transferring that around. Now everybody's got plenty of B1s who want vaccine. And so every single dose that hospitals are receiving, they can find someone to take. Anybody want to comment on that? I mean, you have no shortage of people that want that are in B1, you were at the end of 1As. I think you were all like, we're ready to go. We're ready to go. We're ready to go. We want to go to B1.
Cassie, if I could, yeah, you're absolutely right. But we really can't understate, you brought up the issue where Swedish helped Skagit, to keep our doors open in terms of vaccinations. The one great thing is, Snohomish County, Skagit County, individual providers really are working together to try and make this happen. Although we've now reached the point where you're right, we've maxed out. Everybody who has vaccine needs that vaccine and more. But it really was a great silver lining in terms of the 1A process, how everybody did get together and work towards that reallocation, including you personally setting up some things for Skagit. So it needs to be said, it was a great effort. We'd like to continue if we have the vaccine. So.
Thank you. It was fun. It was a kind of exciting, texting, I heard from someone we might have a little bit to give, and I heard from someone else we don't have any, and so I'm texting them both okay, 500 tonight, can you move it? And we got to get DOH approval, and every single person that we asked who had vaccine surplus said yes, absolutely, without hesitation, which was really wonderful. Another question is there any sign that the data reporting requirements, which hospitals have reported as pretty laborious, will be lightened or changed? No. But it's an entry. So I actually got to see this at Swedish. You're not reporting to the state, we did 560 vaccines today. You're reporting to the state, here are the 560 people I vaccinated today, by name, birth date, etc. Each individual has to be entered into the Washington Immunization Information System so that each individual is tracked. It's important, I think, to do that, but it is very labor intensive. And if people have filled out some of the errors that were some hospitals are giving vaccines, collecting the forms in paper, and then going back and entering them later. And I think, Tom, you all might have been doing this.
Yeah.
And then found later there was a lot of errors. People put, instead of in the line that said birth date, they put today's date, or they go by a nickname. They put Tom DeBoard instead of Thomas DeBoard. And so then you couldn't find them easily. And then so they were having to call people back and say, I need more information. What is your birth date? Is this you? So I think a lot of people have transitioned to the doing the data entry on site. And that's the Swedish, what I got to see at Swedish was twice as many data entry as there are vaccinators. So Tom, maybe you could comment on this, because I know you've changed your process quite a bit.
Yeah, we're working through it, and it is very laborious. There's no way around it. I mean, we're currently, again, we're still in a process where we are loading the data on a real-time basis, but we're loading it into an Excel spreadsheet, and then we upload that to DOH on a daily basis. And then we have to go back and get caught up. But, as we've built our clinic up to where we can do 800 to 1,000 vaccines a day, I mean, that's going to take probably 3 full-time employees every day to be able to enter that information. So long-term, that's not sustainable. And one of the things we're hopeful for is a company like Microsoft or others that are looking at the technology that's out there. You know, all of us across the entire state, and let's be honest, across the country, have kind of had to stand up our own kind of scheduling system. Some people use their call centers. We don't have a call center at Overlake, so we couldn't do that. So we used an online scheduling system. We don't take any walk-in appointments. Everything's by appointment only. And so this data then does have to go in afterwards. So one of the things we're hopeful with this collaboration with Microsoft is that eventually we'll have a scheduling system that people can go into and schedule. And then as soon as their vaccine is done, we can just hit a button and then that'll upload right into the state's database. That's where we've got to move to. We're not quite there yet, but that's where we need to move to.
Rosalinda.
So we have definitely cross-trained staff. Our EHR automatically populates that patient data into the state immunization software, so that has helped us there. However, the onboarding, the initial registration process is time consuming, but we did choose to do that from day one, knowing that it was more laborious. So we cross-trained a lot of additional staff to be able to register patients, and that has really saved us. And so that's just an idea. Maybe some facilities can consider doing something like that.
Thank you. And I think we're hopeful that the Microsoft solution that's being worked on is something that will be shared with all hospitals. Because as Tom said, if you could get people to do their scheduling and provide all their information, and then it gets verified at the time who they are in the Washington Immunization Information System. Swedish is finding every day that there's about 20 dead people that they're vaccinating. They're not actually dead, but the system shows that they're dead. So then they have to call DOH and say, actually, this person's standing right in front of me, very undead. And so just that kind of error, that if that could be fixed more on the front end, that'd be great.
And, you know, this is Tom again. And, you know, as Rosalinda mentioned, you know, they're using their EMR. I know Evergreen is, I think, using their Cerner system. We certainly looked at the possibility of using Epic. And again, like everything, you know, you look back and think, boy, maybe we should have done that, or we should have done this. But at the time when you're trying to stand something up in real time and do it quickly and make sure you're doing it safely, you know, we made the decision not to set up a new, you know, in essence, an episode within our Epic system for every one of these, which would have had the ability to upload it. But again, moving to this system, like Cassie just mentioned, that's really the long-term thing. And then that's something that can be scalable and grow and go out to many other sites. You know, we're hoping that within this collaboration, we can test it out and work. And then others within the entire state, hopefully we'll be able to utilize that and it'll benefit everybody.
Here's a question I don't know that we know the answer to. Are people respecting the eligibility phases? Rosalinda.
If we dare question them and they're not eligible, it's a very bad conversation. They are irate and difficult for staff to deal with. So we can look them up usually in several systems to see if they're eligible or not. But if they're not, very, very angry people.
Yeah, and this is Tom again. The one thing I was going to say is that, you know, it's really impossible for us to police it in its entirety. We communicate as much as we absolutely can in our website and everything we send out, the information that we have within our scheduling system, signs that we have in our clinic, that we continually remind everybody that we are only vaccinating people by appointment only, and only those that are eligible for either 1A, 1 and 2, or 1B1 now, and that's it. And the eligibility is pretty clear. I know there was some confusion about, you know, the multi-generational families, but I think most people have worked through that now. But if somebody goes in and says they're over 65, or, I mean, that's kind of an easy one, so you can look at a driver's license. But the reality is we just can't police it for everybody. But we do everything we can do to communicate to people, please, schedule only if you're eligible, answer the questions honestly, bring your screenshot of your eligibility from the phase finder, and then we'll vaccinate you if you have an appointment. But it would really be difficult for every hospital to take it to the nth level to see if somebody really answered every question honestly. It's almost impossible.
And the 1As were pretty easy to validate because they had licenses or letters from their employers. Over 65 is obviously very easy to validate. It's the multi-generational household over 50 that's challenging. Is the state redistributing vaccine if facilities have not been able to get through it? All of our hospitals have been able to get through theirs. We have not heard from any hospital that has not. And as we said, we were ready to go to B1. We were not sitting on vaccine, unwilling to vaccinate. We were not allowed to vaccinate. And we had gotten through the 1As. You all heard us say this. We're through the 1As. We want to go to B1. We're ready. We've got vaccine. We're ready. And so once the governor said, yes, you can go to B1, we opened our doors and have plenty of people. So we've gotten through ours. So I don't know about other providers. Has anyone heard of anybody having vaccine redistributed? We do not have insight into what's happening, for example, in pharmacies or some of the clinics. I don't know if there's been redistribution there. Any other questions? Vaccine waste, any reports? Everybody's tracking their wastage, which I think is quite small. Anyone want to comment on your wastage numbers?
Yeah, this is Tom from Overlake. We're under 0.4%, 0.41% under that for total wastage. Out of 10,000 doses, we've had less than 40 doses that were wasted. Early on, we had just some folks that just really had to kind of get used to how to, prep it. We, of course, are using Pfizer, so they're frozen. They have to come out and be thawed. Then there has to be this prep for them. Last week, for instance, we probably vaccinated close to 3,000 people and did not waste one dose. Out of all of those doses last week, over 3,000, not one dose was wasted. There's lots of people out there like, hey, can people line up at the hospital at the end of the day and any doses you have left over? Of course, none of us want to ever waste a dose, but I think all of us have worked really, really hard to create systems to maximize the use of those doses, and the waste, I think, across the board has probably been pretty low across all the hospitals.
Thanks. I will say one worry that we do have is if people are scheduling multiple appointments because they're worried about their appointment being canceled and then don't show up. That's not happening yet, but we're worried about it in the future. Brian, you were about to comment?
Yeah, at Skagit, since the beginning, we've wasted 3 doses, and all as a part of the actual vaccination process. It helps to maintain a list where you can, we call it SOS list, where you can call out, because again, the worst thing we can do, frankly, is waste vaccine. So we're actually really pleased with where we are so far.
Hey, this is Rhonda from Estrie Health. We have not wasted any yet, with the goal of not to. And we have people on standby, people that are scheduled for the next day. We always have, we're looking at that last 10 doses as the clinic is ending to ensure that we have somebody available. Even if we have to wait a little while and somebody comes in, we have staff that will wait for them to come in.
Thank you. Okay, another question about, is there concern about getting the second doses if you're using 95% within 1 week of receipt? The second dose communication has been very confusing about whether you should reserve them or use them. There is massive concern about getting second doses. We've had a lot of assurances from the state that they'll come. I bet that none of you feel real calm about that. So maybe you could comment on how you're feeling about your second doses. I'm hoping they'll all come and we'll be fine, and that will help everyone feel better and calmer about it. But there is a lot of worry about we've got to get the second doses in the time that's prescribed, and worried about it. Anybody want to comment?
I heard this morning that the CDC is potentially giving you up to 6 weeks to get your second dose. I don't know if that's true or not, but right now our shipments are mixed. We don't know when we get our shipment every week how much is first dose and how much is second dose. So we are setting aside how much we know we need that week for second dose, and then only scheduling what's left over for first dose. So there's our reduction.
Yeah, Cassie, this is Tom. I would say there's definitely anxiety. Let's be honest. There's lots of anxiety by all of us. Are we going to continue to get the doses? Again, we've been told, keep giving out the first doses. You will get your kind of auto shipment of the second doses 3 weeks after, or 2.5 to 3 weeks after you got your first dose. That did occur for us with our very first allotment. We did get that auto shipment of the second doses, but again, Now we have to wait and see, is the next one going to come? Is the next one going to come? We were only a little bit over a month into this, but there is a lot of anxiety because we need those doses to be able to meet the expectation. And people are nervous that, am I going to be able to get my second dose timely? It's probably the thing out there, I think, from the public and our patients, it's creating the most anxiety right now.
I agree with Tom. That's what we're hearing from the community as well. When we're scheduling them for their follow-up is, can we ensure that we have the vaccine available?
Evan, is your question about, is notification about vaccine coming improving?
Sorry, yeah, I'll just speak because it's a little quicker. I'm wondering if notification from the feds to the state, then to hospitals, is improving time-wise. One of the early concerns was that you might only get 24 hours notice that vaccine was being shipped, and it was somewhat of a surprise. Is that timeline shifted at all? Is it getting better?
This is Tom from Overlake. I reached out to our pharmacy director, who's kind of heading up our clinic, just to get an idea of what have we been notified as far as what we're going to get this week. And as of this morning, we asked, for instance, last week for our allocation for this week, and we still had not gotten the notification yet as to what we're going to get this week. We did a little bit earlier this morning get notification about supplies coming, which is always our favorite thing to get, because usually when we get the notification the supplies are coming, that means the vaccines are coming shortly after that. So we feel good about it. But in all honesty, I don't know what the number is.
And by Tom, you mean by supplies, you mean the syringes and all the things that So
yeah, the way it works, we get that notification first. So the syringes, the gloves, all of this stuff to be able to administer the vaccines, that usually comes first, and usually the next day then the vaccine. So we did get notification that supplies were coming, so we felt really good about that, because that usually means the doses are coming shortly after.
And Tom, to clarify, you don't know what your allocation is for this week?
Right. I haven't seen that number yet. At least as of this morning, I haven't seen what the number is. We know what we ask for every week, but again, I haven't seen what the number is going to be yet.
Other folks want to comment on the timing of when you hear what you're getting?
Cassie, this is Brian. I think it's gotten a little bit better in terms of timing. We found out today what we're going to get tomorrow or Wednesday. And we didn't know what we're going to get compared to what we ordered, but we have heard today, which is much better than it just showing up at the door. And at least gives us a little bit of time to plan. So it's not at the level it needs to be able to appropriately schedule and plan out for the future, but it appears it is getting a little bit better.
And again, what we've asked for before is, could hospitals be told that you're going to get a base amount? You're going to get Skagit, you'll get 1,000 doses every week. And then if more is available, then they could get bumped up, but at least you'd know that you've got something that you can work with. Because some hospitals are getting zero. Some hospitals have weeks where they've got none. Skagit, I think you've experienced that.
Right after our very first allocation of 975 doses, we ended up going to the fourth week, so 3 weeks in between, with nothing, and which made it very difficult, obviously, to plan. But it's where it is. So.
Well, I think we're at the end of our time. Thank you, as always, for joining us. We are all available if you have further questions. We really appreciate your partnership. If we have specific messages we could ask you to carry to the public, it's wear a mask, wear a better mask.